Hi, everybody. This is Michal Geba from Triventures, and we're continuing the series of interviews we're doing with Triventures portfolio company CEO, thinking together outside the box during the crisis of the COVID-19. Today, I'm very pleased to have Matt Johnson, CEO of EarlySense, together with us. Hi, Matt.
Hello. Thank you for having me.
Absolutely. So EarlySense is a company that we have invested several years ago, and today more than ever, I think it's in the first line of fighting this horrific crisis that we are facing all over the planet. So Matt, maybe you could first of all share with us a little bit about who is EarlySense and what do you do and what does the company do before the crisis,
Sure.
And maybe tell us a little bit what's going on these days.
Great to see you again, especially during the crisis. So EarlySense is a company based in Tel Aviv, Israel, with a U.S. office in Boston, Massachusetts, that makes a contact-free, continuous patient monitoring solution that gives hospitals, skilled nursing facilities, and other healthcare providers an early warning system about patient deterioration. We make a sensor that hides underneath a mattress, and without any contact with the patient, without any participation by the patient needed, we capture motion in the form of waveforms, and we translate that motion into heart and lung function, which give us a terrific indication and early warning of whether a patient's deteriorating. And so the sensor alone is pretty cool and fantastic technology. What makes the solution even more impressive is the big data aggregation of tens of thousands of these sensors and millions of patients having been in an EarlySense bed. Collectively, we can observe quite a bit about a patient. And we can see when a patient is starting to get out of bed, so we can anticipate a bed exit event, which may lead to a fall. Furthermore, we can anticipate when heart and lung function, when heart rate and respiratory rate start to rise, we can see things like respiratory depression. We can detect things like sleep apnea, and we can give caregivers that few hours or even days head start so that they can intervene before a patient has that deterioration event. And what that typically means for our hospital clients is they see things like a 50% reduction in patient falls, 60 to 65% reduction in pressure injuries occurring, and even as high as an 80 to 84% reduction in code blue events, which, as you know, are never events for hospitals and often lead to really bad patient outcomes. And so in the case of sort of the time before coronavirus, we had accumulated about 300 customers worldwide, most of which were hospitals and skilled nursing facilities in various countries around the planet. And we were pursuing a growth strategy by building out channel partnerships, which were very important to us, especially in the acute care space, and a direct sales force that engaged and signed up and implemented particularly post-acute clients with some acute care customers as well. We have a partnership with a global bed manufacturer called Hillrom, where EarlySense's technology is fully integrated into the most sold bed in all of North America, the Centrella bed. And again, before coronavirus, we were seeing a steady growth. We'd gone from having a few thousand to maybe 10,000 units in use around the country and around the world, to that number being in the 30,000s at the end of last year, anticipating about 50,000 by the end of this year. Since coronavirus,
now?
Yeah, so a lot has changed in the past, say, 60 days. So since coronavirus, two things, sort of macroeconomic things, have happened that I think have affected all healthcare companies and have very specifically affected EarlySense. Number one is that we've seen global recognition that the worldwide hospital and nursing home bed market has been too small. In other words, there are too few beds per capita in nearly every country around the world. So we've seen our total addressable bed market increase by, based on our estimates, as high as 20 to 25, maybe even as high as 30% as a result of coronavirus, as every country around the world scrambles to buy more hospital beds. And so on the one hand, that's very positive just from a market development standpoint. Also, having a partner that's the world's largest hospital bed maker is very helpful. Their addressable market has increased, and thereby our addressable market has increased. We also believe that the coronavirus has shined a very specific and very bright light on a couple of attributes of the EarlySense solution that were meaningful and important before, but are particularly meaningful and important now. Those being the fact that, number one, our solution is contact-free, which before coronavirus meant that we had very few adherence and compliance issues from patients. They didn't have to interact with the system, and so therefore their compliance was about 100%. Now it means something entirely different, which means that the contact-free nature allows us to protect caregivers within our hospital and nursing home clients. And this is proven out very vividly at Sheba Medical Center in Ramat Gan in Tel Aviv, wherein immediately after they discovered coronavirus cases in Israel, Sheba was part of a huge effort to create a quarantine ward, and EarlySense featured very prominently into that ward, where our monitoring technology could observe vital signs, could observe heart rate, respiratory rate, deterioration, motion of these patients that were in the quarantine, but they could observe it at a safe distance outside the patient's room.
You're basically saying that the caregiver could now get the whole spectrum of analysis and analytics about the patients without touching them in a remote way. And if I recall correctly, you have been the first technology to be implemented in this kind of ad hoc hospital that Sheba put together for the COVID patients, right?
Yes. So Sheba we had a running start in that we had a good working relationship with Sheba at the onset, and we were able to really quickly collaborate and set up this system. The people at Sheba did amazing work, and Dr. Zimmelman and others very quickly, very rapidly sprung into action in a really interesting way. This also allows the hospital to save critical PPE because the caregivers don't have to gown up and down after every entry just to take vital signs. And so if you think about the crisis around PPE availability, this is huge.
What's happening now in the States?
Yes, we've seen several hospitals in the hotspot regions in the United States make urgent phone calls to us, and we've been able to deliver and meet those needs really quickly. In New York City, we've signed up about a half dozen new footprints with incredible speed. And one of the terrific innovations that I'm most proud of my team on has been the ability to do these implementations in a nearly fully remote way, which is just terrific.
It's not easy to do those changes on the fly, kind of battlefield implementation, where usually it took a couple of weeks and a few people to go and do the work on the ground. Tell us a little bit, how does it work, and how you as a CEO kind of changed that and made that be possible?
Yep. Yeah. So the work by the teams has been phenomenal. I think my job has simply been to frame up the problem on a macro basis to say, look, we can't go on site, but these hospitals need us. You're a creative team, you're brilliant engineers and data scientists and algorithm developers, client implementation specialists, etc. We can't stand by and say, well, there's nothing we can do. So instead, we have to go solve this problem. And what I found during crisis past, and then I think it's proven true during this coronavirus crisis as well, is that when the problem becomes big and audacious enough, that really smart and really capable teams step up, and creativity is discovered in places that they didn't know it existed.
It's not the big companies or the small companies will survive, but actually the ones that will adapt fast. And I have to congratulate you, Matt, and the team for doing those adjustments really fast. It's not obvious to do something that, you know, a whole team of about 100 people were used to do in a certain way, and then change it on the fly to enable, you know, what the market need. I know it's, you also faced some, you know, you have some doors that are opening, doors that are closing. It's harder to get into hospitals, certainly hard to get into nursing care facilities. Right. That is a big market of yours. So tell us a little bit, what are you doing in the post-acute, in the nursing homes?
Yeah, so nursing homes have a unique version of the problem in that they're downstream of hospitals. They will get very critical discharges from hospitals of people with coronavirus, and moreover, they're significantly less resourced than hospitals, and so they don't have a biomed staff like a hospital does that can help with technology implementations, and they typically have let's say a slightly more fragile IT infrastructure than a hospital would have. And so we're engaged. We have about 125 post-acute sites, skilled nursing facility sites as customers. And so we're engaged with those sites on a daily basis, helping them to prepare and then helping them to scale up their use of EarlySense in a way that makes sense. We're, as quickly as possible, we're translating the lessons learned from our hospital clients so that we can illustrate the creativity and the things that have been learned at Sheba, at Mount Sinai, at the VA, and other acute care hospitals, so that those post-acute can put best practices into place very rapidly.
EarlySense is the company that I think Avner Halperin, who started it a few good years ago, came up with an amazing technology that was before its time. But now, with billions of data points that you have collected and generated such accurate algorithms that could not only sense but predict, comes at a super critical time where EarlySense, I think, really can save lives and help the technical staff and certainly the clinical people in the hospitals really help fight this COVID-19 crisis. And as a person, as an investor, as a partner of yours, I'm very, very excited about it. What in your career, maybe you can share with us, have helped you deal with this crisis the way you've done?
The lessons that I've learned previously have been mostly around anticipating and then acting very quickly around market corrections that allow for obvious solutions to fill those gaps. In healthcare, as you and I have discussed before, for better or worse, sometimes the best, smartest, keenest technological solution doesn't win the day because healthcare is driven a lot, more than any of us would want to admit, by habit and inertia. And this is the way we've always done it. This is how I learned to do it in medical school or nursing school. In those situations, you can't, evangelizing is not enough, right? You can scream it from the mountain, but if the market is not ready to hear what you're screaming, it doesn't matter. And so in this case, I think the team has done a wonderful job of saying, this is the moment we've been waiting for to illustrate this value and to have the market very clearly receive the value. Early in my career, I ran a company about 10 years ago that connected caregivers and families online. And it was a good online senior care business that was chasing what we knew to be a massive need, but what we also realized was that we were ahead of the market in this way, and so we pivoted and evolved, and we had to, or we wouldn't have made it. And so much in the same way, I think EarlySense is positioned very well technologically and infrastructurally. And so now what I think this has required is some agility, because it's not, we can't just say, oh, that plan we made so many years ago, now it's time to move on. It's time for a new plan, and the team has had to evolve fast.
No, I completely agree, and I think this is an opportunity for everybody, for EarlySense for sure, but actually for the healthcare systems. I think that for many, many years, both you and us were talking about transitioning the care from the hospitals to the community and clinics to the home of people. Right. But we needed a shakedown. We needed, unfortunately, a crisis for additional people to understand it faster. It is today projected, or before the crisis, it was projected that digital health will multiply itself by 6-fold in the next 5 years. We come from a $90 billion to $500 billion by 2025. And personally, I think that this will be just the beginning, especially after this shakedown that we're all undergoing, with more realization that technologies like that in the home as well as in the hospital are possible and part of what we're going to see. As
we were saying on an internal call this morning with our regulatory folks, as the old expression goes, you can't put the toothpaste back in the tube. Some of the stuff, I think once we've moved through this, I think it stays.
I completely agree. I hope for the world that it stays and that we'll implement more and more technologies that will help us take care of people in a new way. Matt, thank you very much. Continue your amazing work. You're in the team in the States and in Israel, really helping patients and helping the medical and clinical staff protect themselves and take care of people all over the world. Thanks a lot, and best of luck, and Corona high five.
Yeah.